Again, 20 days, more or less, until the end of open enrollment. And here are the latest numbers on Obamacare. According to the government, 4 million people have signed up for private insurance. Plus, with Medicaid expansion, a healthcare consulting company, Avik Roy, reports there are also between 2.4 and 3.5 million new Medicaid enrollees. The Centers for Medicare and Medicaid Services, or CMS, says another nearly 9 million people are now determined eligible for Medicaid. And that brings us to our next topic. Some of those who are eligible or who are already enrolled in Medicaid include prisoners. Avik Roy, a senior fellow at the Manhattan Institute, quoted in a New York Times article about this just recently, said this, quote, "There can be little doubt that it would be controversial if it was widely understood that a substantial proportion of the Medicaid expansion that taxpayers are funding would be directed towards convicted criminals." You should have seen that quote. Hopefully we'll get it for you. In the meantime, Avik Roy is here so he could actually talk about it, along with Michael Weinberg, senior policy advisor to the Bay Area Council. It is an interesting thought, Avik. I think a lot of us didn't know that, or maybe don't really know how to feel about that. Why do you think it's controversial?
Yeah, so I wrote about this today for Forbes. The impression you'd get from the advocates of the Affordable Care Act is that there are these 50 million people in America who are uninsured, and the reason that they're uninsured is because they're being denied coverage by mean insurance companies due to pre-existing conditions. And the truth of the matter is it's only several 100,000 people who actually have that problem. The vast majority of people are either people who don't want to buy insurance because they think it's too expensive or because they can't afford it, or it's this population, people who are convicted criminals or have been through the criminal justice system, who haven't been able to re-enter the workforce, have low incomes, haven't re-entered society, and therefore are eligible for the Medicaid expansion. It turns out that more than a third of the people who the Medicaid expansion affects under Obamacare are convicted criminals or ex-convicts.
On that, Micah, in certain places like Chicago, for example, at Cook County Jail, according to the New York Times, when inmates are enrolled, when they're doing intake, they're actually enrolled as well in Medicaid now. What's your take on this? Good thing, bad thing? What should we think about it?
Well, we could talk about morality and compassion, but let's talk instead about public safety. Particularly prisoners leaving prison, getting health care coverage dramatically reduces recidivism, so people going back to jail, and reduces crime. And so the evidence is not mixed on this, and I think it's a very good thing.
Avik, about that, is this a good thing because they have coverage now when they leave?
Yeah, so the evidence is actually a little bit more mixed than what Micah suggested, but I would say this. The issue of getting prisoners back into society and civil society and back into the workforce is a very important problem. Some of my colleagues at the Manhattan Institute, particularly Howard Husick, he worked with Cory Booker when he was then mayor of Newark on just this problem. But the real issue is not so much Medicaid, it's about getting them back in the workforce, because the problem is once they're stuck in a government program in the kind of the government welfare state, they never actually re-enter the workforce, and that's the most important thing for making sure that you avoid recidivism.
That's an interesting point, Micah, that again, this is just one more government program that then they're involved with. Other opponents of this say this is already an overburdened program and this is just going to overburden it further. What do you think?
It's an interesting point. It doesn't happen to be true. So the entry points into the workforce are generally at a lower income level, which means that many of them are not going to be receiving private insurance. So Medicaid actually helps people re-enter the workforce at that level rather than hurting them.
Avik, what about the point that taxpayers are paying for the care and well-being of prisoners, whether they're in a county jail, whether they're in a federal prison? We're all paying. In certain situations, it's the state that's paying the bill, and that's what the New York Times is pointing out, that this is a way for the states to shift some of that to the federal government, which is attractive, being the high cost of prisons. Does it really matter to taxpayers? I mean, we're paying for it one way or the other. Does it matter if it's through, Medicaid, or we're paying the health expenses because it's the local prison?
It does matter because, first of all, the Medicaid program is a lot less efficient in the way it delivers care and the effectiveness of that care. So studies have shown that people who are on Medicaid have no better health outcomes than people with no health coverage at all. And so the thing is, if you actually deliver that care on a more local level or on a state-based level where states have the flexibility to deliver the care that inmates actually need, the quality of that care is going to be a lot better. And the other point to make, again, starting from the beginning, is that the presentation of Obamacare was that it was to help all these people with pre-existing conditions who wouldn't get covered. So there's a false advertising element to this. And I think, again, we can have an intellectual public policy debate about the factors that would help prisoners re-enter civil society, but that is not the debate we had in 2009 and 2010.
Micah, what about that this is more what some would call big government, the big federal government taking all of these prisoners or inmates underneath their umbrella versus something that should be dealt with, as some argue, at a state level? What do you think about that?
So one of the things that Avik mentioned was this idea, which has been thoroughly debunked, that Medicaid doesn't make people healthier. But the Oregon study, which is what a lot of people point to, actually did show improvements in mental health. And it's mental health problems that are the main problems keeping prisoners from re-entering society. As many as 50% of people leaving prisons and jails have serious mental health problems, and this will help them, and it will help them re-enter society. That's what the evidence shows.
Yeah, none of what Micah just said there is true. So the evidence around health outcomes in Medicaid is thoroughly and overwhelmingly that Medicaid doesn't improve health outcomes. On the specific issue of mental health, the way that the New England Journal of Medicine article, the Oregon Medicaid study measured mental health was not relevant to the inmate population. So what the inmate population suffers from are things like schizophrenia. What the Oregon study measured was were people happier or less happy when they thought they had health coverage under Medicaid before any medical intervention had actually happened. And of course, if you think you have the security of health coverage, you might be a little happier. But when that health coverage actually doesn't end up working for you, you don't end up as happy in the end.
I only have about 20 seconds. I want to give you the last word.
Yeah, sure. Thank you. So that word that he used, security, is a really important word. Health coverage does a lot of different things. It provides financial security, which means that you're less financially stressed and less likely to commit crimes. It provides mental security, which reduces stress, which is more likely to reduce crime. There is many, many important reasons to get people health care coverage, and I'm very glad that we're doing it for this population.
I'd love to have you both back because we went over a big span, the economics of it, the social justice part of it, whether or not we're doing it in the right way, and there's certainly a lot more to get to. So Avik and Mike, I hope you'll come back and join us again.
Thanks for having us.
Thank you so
Anytime.
much. Appreciate it.